Assalamu alaikum and welcome to this week's Journal Club, where I'll be presenting a paper published in the BMC by Liu and colleagues in 2024 titled Single versus Multi-Visit Approach for Fragment Reattachment in Complicated Crown Root Fractures, a cohort study. So the objective of this study was to evaluate and compare the efficacy and adverse events of single visit versus multi-visit approaches for fragment reattachment in complicated crown root fractures, or CRF, of anterior teeth. So the study is a prospective cohort study. It followed the preferred reporting items for observational studies in endodontics probe guidelines. For the sample size, they had 20 adolescent patients, and they were 10 per group with a total of 22 affected teeth, and all patients were between 10 and 18 years old. For the methodology, as I said, there was two groups. For the single visit group, fragment reattachment, root canal treatment, and fiber post restoration were performed in one session immediately after the injury. And for the multi-visit group, treatment was split into 3 visits. For the first visit, initial fragment reattachment with temporary root filling. The second visit was root canal treatment performed 1 week later, the second visit, and the third visit, post-restoration, conducted 3 days after the root canal treatment. And for evaluation, it included operative duration, intraoperative pain or fatigue measured by the VAS and NRS-F scales, periodontal health, which included probing and bleeding on probing, and a 1-year follow-up for satisfaction and complications. For the results, for clinical efficacy, both groups achieved satisfactory aesthetic and functional results at 1 year. For duration and comfort, the multi-visit approach had a significantly shorter total operative duration, which was 160 minutes versus 222 minutes, and also lower levels of intraoperative pain and fatigue. For periodontal health, the multi-visit patients showed slightly better periodontal health at early stages at 22 weeks, though both groups reached health by 3-month mark. For the complications, the single-visit patients had a higher incidence of transient TMJ disorders, and the multi-visit patients had faced a higher risk of fragment detachment before the final post-restoration, and this was in 1 reported case. So in conclusion, the fragment reattachment is a reliable but temporary technique for adolescent crown root fractures, and the multi-visit approach is generally preferable due to reduced operative strain and fewer complications, though the choice should depend on individual patient compliance and specific clinical needs. And for the limitations of this study, the study had the relatively short follow-up period, which was 1 year, which may not capture the long-term periodontal or functional outcomes. And for the measurement bias, the fatigue scale used was not specific to the dental treatment, which potentially introduces measuring a bias. And also the study excluded patients with multiple fragments or those suitable for pulpotomy, which may limit the generalizability of the findings to the broader CRF patient population. Thank you very much.